Welcome to the Lake Travis Biz Report. I'm Mike Paul, and I am your host of our What's Up Wednesday interview series. And it is my pleasure this morning to welcome Dr. Brynna Connor to our studio.
Thank you.
Welcome, Dr. Connor.
It's great to be here. This is a great space.
Dr. Connor is a family health medicine physician here in the Austin area.
That's right.
And since healthcare is such an important issue to all of us here, particularly with what we've all gone through this past year, I thought it would be terrific to have you come on in and,
Awesome.
and get
I'm
a
glad
little
to be
insight
here.
into what's going on with healthcare and
Yeah.
and your patients and the community. So thank you
Definitely.
again for coming in
Thank
today.
you for having me.
So it goes without saying that this has been a pretty challenging year for all of us, and obviously healthcare has probably been the number one focus for everybody, and certainly for the medical industry practitioners. This has been a really tough, challenging year. So I just want to get your insight as to what are some of the challenges that you have seen this year, maybe personally and perhaps just even in your practice with your patients.
What a year it has been. For good, bad, or indifferent, it's been a challenge in healthcare, in medicine, and keeping people well. I think one of the major challenges that I have seen and has been reported to me most recently as life is opening up and people are starting to resume activities is people foregoing preventative care. You know, it's very important to do certain screenings at a certain age to make sure that certain abnormalities on labs or imaging or surveillance of things like colonoscopies and mammograms and dental checkups have been ignored because people have been fearful to go out into the community and especially to come into a medical office because we see sick people. And so it's been an interesting challenge and dynamic to balance the return of patients coming in with other options. I did a lot of telemedicine through 2020, and we were talking about that earlier, but it has provided a means for people to be seen by a physician or their healthcare provider without having to worry, especially in people who are immunocompromised or they may have other, we call them comorbidities or medical conditions that may make them more prone to getting sick, or if they get sick, to be more sick than somebody who is healthy. And so we have had to balance that. And challenges, there are lots of them. I think people have really dealt with a lot of mental health issues in the last 14, 15 months now, I guess we're going on.
Yeah.
People are working from home. People are with their spouse all day, maybe working from home. Their children, they're having to homeschool their children. Not as much now, but last year certainly it was an issue. And I was constantly being contacted by new patients and existing patients who were really having a hard time with that because it was just a change in their routine, their schedule.
Yeah, and I think that there's just been sort of a new norm. I mean, we've all tried to adjust to, and we're doing video now, obviously, and the whole, really a lot of industries have kind of moved into this remote virtual environment, and healthcare is no exception. And I want to ask you some questions about that in a little bit here about the telemedicine, because that really is a fascinating development, in healthcare. Dr. Connor, let's talk about your approach to healthcare. Maybe also touch on a little bit about your background and kind of how you approach healthcare with your patients.
Okay, so my residency and board certification is in family medicine, and then I've done additional training in anti-aging and regenerative medicine. So I really do look at the whole person. I take a really comprehensive approach and ask a lot of questions. That is one thing that is the takeaway that people tend to say about me when they are referring people is she will ask you a lot of questions. And that's the only way I can really get the history. I look at the body from a preventative standpoint. Obviously, we do address illness and disease, but our goal in our practice is to really keep people healthy and optimize their health for those who are interested in doing that at really the cellular level. So we are talking about longevity. We're talking about aging gracefully. Who doesn't want to do that?
All important
All
topics.
important things. And so it's a much different approach. And the way that my practice is constructed, I'm able to spend a lot more time with patients. And so we're able to do that and take a much more thorough, deep dive into people's health.
Wow, that sounds terrific. And we talked a little bit about some of the challenges that we've all faced here, and certainly that you've faced as well with your practice. So how has this past year and 3 months really changed your practice or your approach to your patients?
Well, luckily for me, I have been fortunate in that we've been providing telemedicine since my practice started 7 years ago. And so for us, it was a very natural movement into, on March 16th of last year, of moving people into telemedicine and offering that to anyone and everyone. Obviously, there are some visits that are much better in person and necessary to come in person. But some certain follow-ups and things like that, lab reviews, things like that can be done very easily by telemedicine. So I was fortunate in my practice. It was a very easy switch to make for a couple of months for us to be able to see people in the comfort of their home or using a telemedicine platform.
I'm just curious, with using telemedicine, if you got to take someone's blood pressure or temperature or something like that, does the patient then have those devices and then they're doing that and then just providing that information to you?
And that's interesting because some of my patients historically would have gone into a pharmacy to have their blood pressure checked, but of course all of those machines and cuffs were taped off during most of 2020, and so many of my patients ended up purchasing online a blood pressure cuff or a pulse ox, which was a popular buy last year. It's amazing how many people actually have a way to be able to check their vital signs when they're in their own home, and so we utilize that. And there are certain adaptive technologies and devices that can hook onto, like an iPhone, for example, to do certain exams, ear exams, and you can do a lot in front of the camera. Doing telemedicine, there's a lot you can do, and there's a lot you can't do.
Close-up shots.
Right, exactly.
Say, let me see that.
Yes.
Open up and say,
Yes, we literally have done that many times. And you can assess someone's breathing, and you can listen for certain breath sounds that would be existent in different illnesses and things like that. So it doesn't take the place of an in-person exam. For certain medical conditions, it's far inferior to an in-person exam, but for certain medical appointments, it works really well, and certainly it works great if the option is that or nothing. So I think it's here to stay. People love it.
I think to be more responsive to your patients, to the ability to be able to pop on, on a virtual visit, it easier for them, so not having to come all the way down, or obviously they're still scheduling with you, but it seems like that maybe just people that one of the pros would be being able to get in and see your doctor and to get that treatment.
Absolutely. It's so much easier for people, and people love it. Just recently, I've had some patients say to me, "Can I please just come see you in person next time?" Of course you can. We've been doing that this whole time. But people have gotten so accustomed to doing the telemedicine appointments, and they don't have to take off of work. They can do it from home. And again, like I said, for certain things, it's completely appropriate, and it works really well. People love it. Patients have loved it because it allows more flexibility for the timing of their appointment. And obviously, with so many people working from home last year, it was just much more conducive to them being able to get in to see a physician when it was convenient for them.
Absolutely. I've taken advantage of that myself a couple of times, and so definitely see the benefits of that as well. So what are some of the common issues that you see people coming in with these days? I mean, has that changed over the past year or two, or is that just curious as to really what people now are coming in? Maybe less flu this last year, for sure.
That's absolutely correct. Less flu. I've seen a resurgence of people doing a lot more screenings that we obviously in the medical field have wanted them to be doing all along, but due to the last year and just changes in schedules and being able to accommodate all of that, some of that has resumed, obviously. In the last year, there have been a lot of people coming in for stress and family stressors and lifestyle stressors and anxiety and depression and fear and questions about what they need to do moving forward. What do their children need to do? What is a recommendation? Because there's so much mixed information out there. What is a solid evidence-based recommendation for what they and their family need to do in order to move forward in all of this? I think the biggest thing has been mental health issues, quite honestly.
And I could see that. I mean, I know you spend too much time with your kids, in virtual learning. I think could drive anybody a little crazy at times. But and that's part of those challenges that we talked about, and the changes in healthcare. Now, hopefully, as things start to improve, as as the numbers now have dropped, as people are starting to feel more comfortable about coming in, seeing their physician, or getting out and working. It's not all. A lot of people still working at home, but people are getting out now, feeling more comfortable. Hopefully that there'll be an improvement. So we talked about some of the challenges of stress in the home, stress in the workplaces, as people work to get back to normal. What are some of the suggestions that you would provide, or some of the tips in terms of online learning, people working at home, a lot of togetherness? I mean, what would you suggest, or what are you telling your patients on kind of how to cope and deal with that?
Yes, definitely. People have gotten to know their families even in much more depth this last year. It is asked every day, almost all day long, because people's lives are just different now. And it's been sort of a reset, an actual reset, a reboot, if you will, of life for many, many, many people. I have many patients in my practice who are teachers, and the last year has been so challenging for them, trying to do virtual only, and then half virtual, half in the classroom, and that has created obviously a lot of stress, and I just respect them so much for trying to do what they do.
I think even just from a technology standpoint, not everybody's at the same level.
Yes.
I think there's been some challenges there, just
Absolutely.
in how do I effectively communicate
Absolutely.
to my students, or
Absolutely,
or my
especially the
job.
little kids. Can you imagine teaching kindergarten in a virtual environment? But back to your question. So with this great reset, reboot, and people really looking at what is important to them, combined with the stress of the last 14, 15 months, wherever we are now, I've lost track, but March 16th was sort of a important date in my mind and many others in the medical field. Back to basics. I do take a very comprehensive approach, and we have really gone back to basics, okay? If you think about what does a human being need to be functional and to be good at what they want to do and good at what they do, then it's a lot of mental health care, it's a lot of self-care. Back to basics. Are you sleeping well? If you're not, let's look at what your sleep hygiene is, or what is your daytime routine like? What can we do to make that better? How is your hydration status? Hydrate from the inside out. And what is your nutrition like? And what is your alcohol intake like? And what is your stress level like? Because the stressors that have happened in people's households over the last year, and in the workplace, and trying to have the workplace at home in the middle of the household with your dog or your cat or your children or your spouse also there, and being with them for an extended period of time every single day, has posed those challenges. So I have really been advocating for my patients to get back to the basics. Get back to, let's make this more simple, and what do we need to do to now move forward without making it complicated? Let's make sure that your basic health needs are taken care of.
And what would be some of the most important tips? I mean, if you had to provide some advice to people to say, hey, how do I get back to basics? How do I get back to that point? Is there certain things that people can do right away?
Get out with nature. That's huge. You don't have to go join a gym. You can, of course. A lot of people now have gyms in their homes because they haven't been able to go to the gym, but get out with nature. Get some sunshine. Get your body moving. 30 minutes a day, 5 days a week. Make sure you're getting good rest, hydration, nutrition. Make sure that you're addressing the stressors in as healthy way as possible. If you need a life coach, if you need a therapist, a counselor, a family counselor, whatever the case may be, let's do that. Let's see what we need to do. I'm a very logical person in my practice, and I like to give actionable steps that are not overwhelming, because people have been absolutely overwhelmed this last year and a half. Another thing that I do in my practice that is a little bit different, because we do take a comprehensive approach, is we look at prevention. So it's a little different than the back to basics idea, which tends to simplify things, but it's, what do you need to ask your doctor? familial risk, genetic risk factors, what runs in your family. And we do some genetic screenings in my practice that really helps people assess what is their risk for developing, for example, certain types of cancers, so that they can then look at what they need to do moving forward from a prevention standpoint to help mitigate that risk.
And I know you touched on this, but how important it is not to put things off, because I know this past year that a lot of people just said, I'm kind of afraid to go see my doctor, or maybe, whatever my condition is, it's okay. I don't want to take those risks. So I think you talked about the preventative care, how important it is to identify things early on. And I guess that's part of getting back to basics, as you said.
Absolutely. Those important health screens that many people have put off, which has always been, always in the last 14 months, it has been a source of frustration for those of us in the medical field, because we still want people to be able to take care of those things. But let's face it, people have had other reasons and other stressors that have taken precedence. So self-care, medical care, health and wellness is now becoming more of a priority as we get back to basics. And I thought about that as we prepared to talk today. I thought, that's really what this is. Because if we look at, okay, what screenings do I need to do? What is my familial genetic risk? And what is going to help me to launch into the next 6 months or 12 months of my life? What do I need to do to feel good about what's happening in my life and my family?
Just a side note, I read an article this morning about, it was interesting that they think that they have figured out a way of dealing with aging where people could actually live, they could reach 150 years old, which
Isn't
would
that
be
incredible?
be incredible. And it kind of got into the whole thing about, okay, what, everything from supplements to identifying, what kind of your lifestyles, and I think just kind of having a better understanding, so you do live a healthier life. And of course, there's always the exception, the person that says, how did you live to 120? I ate 3 raw eggs a day.
Yes.
Something like that, okay?
Yes, there's always those exceptions, or whatever you want to call those.
But for most people, it's just about doing the right things that, sometimes we forget. And, so that we do want to live a healthier life. We want to get sleep. And as we start to try to get back to normal here, I think it's... I think it really resonates, that, hey, we just kind of need to just take a step back and say, hey, what did we do before that worked? And so that it's interesting, kind of the direction, I think, that.
And it is fascinating, because I have patients in my practice who are super extroverted, who've had a really hard time the last 14 months. And then I have patients in my practice who are introverted personalities. And they could not be happier. So there's different thought processes, and some people are not planning to return to work in an office, and some people can't wait for that to happen, and being at home has created a lot of anxiety. But to your point about longevity and healthy living, aging gracefully, of course, if you can do that and really take a preventative standpoint and look at your health care, or your health rather, from a preventative and comprehensive standpoint, then the goal is to live as long as you shall, as healthy as possible.
That's
and
the ultimate goal.
Not be sick.
Absolutely.
So it is optimizing nutrition, everything that we just talked about, but supplementation with certain vitamins if necessary, not to over supplement and create, like I like to joke with my patients about making expensive urine. That is not the idea here. The idea is, if you're a vegetarian, you may need to supplement with something different. If you know for a fact that your labs have shown in the past that you're deficient in a certain area, then how do we improve upon that? And it's those micro changes that really do affect the larger being down the road.
So I think it's important that when you see a new patient or an existing patient, that they ask you the right questions, and you're asking the questions for them, so that you do really understand what their lifestyle is. And because I think it seems like to really get an understanding of what might work best for a particular patient, you really have to have that knowledge. And sometimes we don't all share
Sure.
everything as openly as we ought to. But
Sure. Yeah, definitely. And we take a real individualized approach in my practice. So when I'm talking to people, I ask a lot of questions and I really get to the bottom of, obviously, what people are comfortable sharing. And get to the bottom of what their goals might be and tailor the visit. I don't follow a cookie cutter approach. So we're able to do that with folks in terms of what their current health status is and what their goals might be.
So if somebody wanted to get more information from you and about your practice and about some of the tips and ideas that you've shared with us today, what would be the best way for them to do that?
They can always call the office number. Our website is also available, which is drconnor.com.
And that'll be on our screen below.
Awesome.
So you can
Awesome. Thank you
take a
for
look at
doing that.
Absolutely.
And they can always call and ask as many questions as they would like to do. I'm happy to get on the phone with people for a short call to see if we might be a good fit. We really try to meet people where they are. People have a very wide, diverse range of goals in terms of what they want for their health care. And we really try to meet them where they are so that they are in charge of their health care. But the best way to reach me is either on our website. People can actually send us a message through the website and also by phone.
Terrific. Well, thank you so much for
Thanks, Mike.
coming in today. You know, hopefully we all learned a little bit here, and we all take better care of ourselves. And you know, as we emerge out of this 2020 experience that
Wild ride.
I think we would all prefer not to go through again.
Definitely agree with that. Yes. Thank you very much for
Thank
having
you.
me.
Thank
Good
you.
questions.